Good evening. My name is Natisha, and I will be your moderator this evening. Thank you for joining our live interactive telephone town hall. We are hosting tonight's event to give Congresswoman Spanberger the opportunity to hear directly from you and answer your questions about the issues facing Central Virginia families, businesses, and communities during this pandemic. We hope you are staying safe. As I mentioned, this event is an interactive forum. Congresswoman Spanberger and Dr. Avula will be taking as many questions from Virginians as we possibly can during this event. If you have a question, you can press *3 on your phone keypad at any time, and you will be placed in line to speak with a member of our staff. They will take down your name and where you are calling from. The next time you hear your name, you will be live on the call, and you'll be able to ask your question directly. You can also ask a question by submitting one through the portal below our online streaming player at spanberger.house.gov. Again, that's spanberger.house.gov. If you are watching on Facebook Live tonight and wish to ask the Congresswoman a question, we encourage you to visit the online streaming portal so you can submit your question. Additionally, if you would like to receive updates from our office via email, please press *6 on your phone keypad at any time, and an operator will collect your email address. We could receive a lot of questions during this event, so if we are not able to address your question, please call our district office at 804-401-4110 during normal business hours. Again, if you have any questions throughout the event, please press *3 on your keypad or type them below the streaming player. Now, please welcome Congresswoman Spanberger.
Hello, everyone. Thank you so much for joining tonight's virtual telephone town hall with Dr. Danny Avula. I hope you and your family have had the opportunity to enjoy some of this beautiful weather. During tonight's town hall, we'll answer questions about the state of our COVID-19 response here in Virginia, as well as the steps that I'm taking here in Congress to combat the virus and work to rebuild our economy. If you've been watching the news, you have probably seen that the House voted yesterday to pass the American Rescue Plan, the latest economic relief package at the federal level. I was proud to vote yes on this important legislation. The American Rescue Plan meets the ongoing economic and health needs of Virginians and the country, and it helps us maintain our momentum in the fight against COVID-19. It invests in a national strategy to build back up the economy and ensure defeating this virus. Notably, the package invests $20 billion in funding for a coordinated vaccine distribution effort. It will also scale up testing and tracing so that we can stay ahead of potential variants of this virus, and it addresses shortages in PPE and critical supplies through the use of the Defense Production Act. The American Recovery Plan will provide support to those experiencing unemployment by continuing to extend unemployment assistance until September 6th, including the pandemic unemployment program that's been so important to our country's gig workers. To help with our economic recovery and to address the impact on families, the American Recovery Plan has expanded the child tax credit and the child and dependent care tax credit. It also includes direct payments to families who are eligible. It provides billions in support to public schools and through 12 universities as well to ensure that our schools have the resources necessary to continue welcoming students back now and as we continue into the future in our fight against this virus. This bill also establishes something called the Restaurant Revitalization Fund, which is particularly important to the constituents across Central Virginia, who I've heard from in roundtables. They, like other small business owners, have been so impacted by this pandemic. And this program, this specialized program, meets the particular needs of restaurants, in addition to ensuring continued access to support for our small businesses. President Biden just signed this bill into law today, and I do look forward to discussing it further this evening. COVID-19 has been in Virginia for a full year. It's been a long, difficult year, and we've certainly experienced tremendous challenges, and we've lost so many members of our communities. At this moment, we're starting to see good news about vaccinations and about the reopenings here in Virginia. We've seen the Johnson & Johnson vaccine get approval, and we've seen encouraging recommendations from the CDC just this week. There's no doubt that we're turning a corner in the fight against this virus, and tonight we'll discuss how we maintain that momentum. I know that reliable information is incredibly important as we work to keep our families and our neighbors safe, and I hope we can answer many of your questions or direct you to the right resources this evening. If we can't answer your question tonight, please do not hesitate to reach out to my office. I am now glad to introduce Dr. Danny Avula. He's Virginia's Vaccine Distribution Coordinator. He'll share an update on vaccination efforts here in Virginia, across the 7th District, and I will look forward to answering questions with him as they come up. Dr. Avula, thank you so much for joining us.
My pleasure, Congresswoman. So happy to be here with you and all of you here tonight. I just let me give maybe a quick update on where we're at currently in Virginia, and really in large part, Congresswoman, thanks to your advocacy and action at the federal level to continue to bring resources and vaccine and supports in to help us weather what for so many people has just been a brutal year. But I will say that vaccination really starts to bring hope and life and a real bright spot in where we've been over the past year. I want to share my screen real quick and maybe show just a quick on the VDH website. So we do a daily update on how vaccination is going. Hopefully many of you have seen this. If not, if you go to vdh.virginia.gov and there's a little tab that says COVID-19, you can navigate to the vaccine summary page. And what you'll see here is a daily dashboard. We're about 2.5 million doses that we've administered since the end of December, and 19% of our population that has gotten at least one dose. So things have really started to rev up over these last few weeks, and we're really excited because just in this month of March, as we look forward towards the end of March, we expect a new infusion of the Johnson & Johnson vaccine that's really going to take us to another level in our ability to vaccinate Virginia. Some of you may remember at the beginning of our vaccination campaign, we said we needed to hit a goal of 25,000 doses and eventually get to 50,000 doses to really meet our aim to vaccinate Virginia by the summer. And I want to show you this. We are on a 7-day rolling average, 53,000 doses a day. And so in large part, again, the supply has increased, the capacity to get vaccine out through our health departments, our health systems, private providers, and pharmacies. And next week, we will be opening a new channel called Community Vaccination Centers. They will start in 3 communities around the state and then layer in as needs arise. These are state-run, but federally funded through the FEMA funding, and so we'll really just augment our vaccination capacity. But I hope that what you see here is, some evidence that really we are in great shape in terms of vaccinating our population. We are right now, most of the state is progressing through phase 1B, and phase 1B captures individuals who are 65 and over. We've vaccinated about 57% of that population to date across the state. And then also individuals who are 16 to 64 with underlying conditions and who fall into one of these categories of essential workers. But, given the pace of vaccination that we've seen over the last month and now into the month of March, we are quickly progressing through phase 1B, and we're getting really to those lower tiers in phase 1B. And I expect that all of Virginia should be able to, that phase 1B, everyone who's eligible for phase 1B, we should be able to get vaccinated by the 2nd or 3rd week of April. And then everybody in Virginia who's eligible or who wants to be vaccinated, we should be able to get through by the end of May and probably a little bit sooner. You heard the president perhaps last week announce that there will be a dose available for everybody by the end of May. And I think that is certainly true in our projections here in Virginia, that anybody, at least a first dose, will be able to have that by about the middle of May, and perhaps even sooner, given what some of the demand looks like. I think we're moving to a different phase of this, where we've moved from a supply scarce environment to really seeing the supply start to come in and there being more and more opportunities to get vaccinated. So happy to answer any questions you have, but I will say it looks very hopeful for us to move through the next couple of months as supply keeps coming in.
Thank you so much for that update, Dr. Avula. And when we started hitting the 50,000, that's an exciting place to be. So congratulations and thank you to all of your team for all that you're doing. It's certainly giving people a bit of bright spot as we head towards the future. So I look forward to answering your questions.
Great. So before we go to the phone, I just want to give a quick reminder that this is an interactive forum and we would love to hear your questions. If you do have a question, you can press *3 on your phone keypad at any time to get into the queue to ask a question. A member of Congresswoman Spanberger's staff will collect your questions. You can also ask a question by submitting one through the portal below our online streaming player at spanberger.house.gov. Again, that's spanberger.house.gov. If you are watching on Facebook Live tonight and wish to ask Congresswoman Spanberger or Dr. Avula a question, we encourage you to visit the online streaming portal so you can submit your question. And with that, we are going to go to the phone. Our first caller is Jeannie from Spotsylvania. Jeannie, you're live.
Hi.
Go ahead and ask your question, please.
Hi, can you hear me?
We can hear you.
Yes, Jeannie, I can hear you.
Great. So I just want to commend you, Abigail, because I vote for you. I think you're amazing. I think all the work you guys have done is great. But I do want to remind you, although we have to worry about our health, we also have to worry about our mental health. And as a teacher and a parent, it's becoming quite scary to see what these kids have lived through during their quarantine. Even my own daughter has suffered through depression, and I consider myself a very good mom. But it's to the point where when we went to the ER because she had tried to kill herself again, that there were literally no beds in the state of Virginia to transport her to. And so then my daughter, who was in crisis, was sent home with me, which as a parent was the scariest thing imaginable. So please, as you're establishing plans and looking at where to spend your money, think about how hard it is. I mean, I have insurance, and I can't even get a psychiatrist for my 12-year-old that accepts insurance in my area. I have to drive an hour and a half away. That's not okay. We have to do better for our kids and our families. We have to.
Jeannie, thank you so much for sharing those comments. And unfortunately, your story is not the first time that I have heard directly from a parent about a child who had tried to take their own life, who was then denied the ability to stay in a residential facility through some of their recovery. So the story that you're telling is not a unique one, unfortunately. And I thank you for sharing it so honestly. I think awareness is so incredibly important about the mental health crisis that our kids and adults, particularly through this time of isolation, are experiencing. To comment on it, because there's a number of initiatives that we have undertaken as it relates to mental health and as it relates to healthcare writ large as part of, in this case, the American Recovery Plan, is that we do have funding for mental health and for substance use disorder care in this bill, noting that it is directly related to the ongoing pandemic. I've heard it from parents, I've heard it from healthcare providers, I've heard it from our law enforcement officials, who are the ones who so frequently respond to circumstances where there's a person experiencing a mental health crisis. Additionally, with this bill, we also ensure that there's a cap for the ACA rate for those who get their healthcare insurance through the marketplace. It's a cap based on one's income to ensure that during this time of significant challenge, people can continue with their healthcare at an affordable rate and continue to have their healthcare coverage. I'm so grateful for you talking about the story, and I know I've spoken directly to the American Rescue Plan in terms of the relief there. I'd also note that the support for our schools, to reopen our schools, some of that's about being able to clean the facilities and purchase the PPE and the dividers that are necessary in our elementary schools, but it's also about ensuring that our schools have the proper staffing to contend with the challenges that students are going to be returning with and have returned with, be those needs for counselors or needs for teaching resources. So this is something that's front of mind for me. I myself have 3 young children, elementary and middle school aged, and so I understand how challenging this last year has been on them. So thank you very much for sharing your story. Dr. Avula, as a physician, I'll give you the opportunity if you'd like to provide any comments. Otherwise, we can move on to the next question.
Yeah, Jeannie, really, it's heartbreaking to hear that. And I've experienced, I'm a pediatrician by training, and actually back in the fall, it was still, until things got really hectic with the vaccine rollout, was still working overnight shifts at a local hospital here in the Richmond area. And one night I was working the ward, and we had 2 patients who had both attempted suicide, but an emergency room, we had 8 individuals, eight adolescents who had attempted to take their own life, who were just waiting for a placement. And so it breaks my heart to hear your situation and know that there are so many kids who living through this pandemic, living through virtual schooling, living through everything that has strained families in the midst of this. So thank you for speaking out. I think obviously the pathways to be able to get help, we need more funding to create those pathways. And this is not just an acute issue, right? These mental health issues are going to last. The recovery is going to last for months and years past the pandemic, and we've got to make sure we've got the supports in place to help families through that.
Thank you, Dr. Avula.
Great, thank you. Our next caller is Christian from Glen Allen. Christian, you're live. Go ahead and ask your question, please.
Good evening, Congresswoman Spanberger. Thank you for taking my call tonight. I appreciate it. I'm a newcomer to Virginia. I'm coming in from Delaware, so I'm very happy to be here and happy to have you as my Congresswoman. My question has to do with educating the general public about the effectiveness of the vaccine. We, of course, have now 3 vaccines available to the general public, which is excellent news. I heard the good doctor tell us about that we have 19% of Virginians obviously vaccinated, for at least receiving 1 shot so far for vaccination, which is good. But I am concerned about the percentage of people within the state and elsewhere who are suggesting that they're not going to get the vaccine at all. My wife works for a water treatment company here in Glen Allen, and at her manufacturing site in Ashland, 60% of the employees at the manufacturing site are suggesting that they don't want to take the vaccine. And I'm concerned about what can the federal government and yourself do to help educate people to get the vaccine and to trust it to be involved. There are a lot of factors involved in their decisions, but I'm wondering what we can do as a society, because we seem to have the tools available, and I don't know how we can use them better.
Thank you, Christian. Thank you, and welcome to Virginia. I hope you're settling in well. Thank you for this question. This is a very important question because we have spent a year learning day by day more and more about this pandemic. And I think that's an important piece. And I'll give the layman's non-medical answer to this question, and then I will turn it over to Dr. Avula. But I think having spent the past year talking about the pandemic with the people that I represent, the impact that we felt, we've progressed in a path where initially we didn't know everything about this virus. It wasn't clear how it was spread. It wasn't clear how we could protect ourselves. And so just as we've learned more about the virus, we have to continue to educate people more about the vaccines that are available. I think notably there was some discussion, the Operation Warp Speed, which was a tremendous undertaking. Initially, there was some misunderstanding about if we being the U.S. government, had followed different procedures for approving the vaccinations. The answer is no. What was happening is we were pushing tremendous amounts of funding towards vaccination research, putting multiple types of vaccines through the testing process. And so that was what was unique about the program. It wasn't that there were any sort of changes in threshold, the tests. It was the fact that we took the extraordinary risk of investing in multiple options, knowing not all of them might actually become, a vaccination that could be utilized. The American Rescue Plan invests funding in a vaccination effort. Just today, I believe it came out today, we see former presidents who are part of an effort. We've got Democrats and Republicans part of an effort to demonstrate that getting vaccinated is incredibly important. And I would just note one more thing. There's also been so much information about the different vaccines that are available. The bottom line is they are all absolutely effective at preventing death and preventing and mitigating hospitalization. And that is exactly what we want to do so that we can save lives, so that we can stop the transmission of this virus and get our lives into a post-COVID place. And so I'm going to stop there and turn it over to Dr. Avula if he'd like to perhaps give all of us some better talking points that when we're going back and talking to friends and neighbors, we can have the confidence to ensure that they know why this vaccination is so important and why they should feel confident taking it.
Yeah, Christian, I think the question around vaccine hesitancy is one that, in the midst of where we are right now, where there's so much demand. And so it's not at the forefront of people's minds. But when we think a month down the road, to get to that final 10%, our goal as a community is to get to 75% of our adult population vaccinated. Why 75%? Because as we look at other pandemics, other epidemics, that you want to get a certain percentage of the population protected to stop the transmission of disease. That term is called herd immunity. And we estimate that it'll be about 70% with the rate at which COVID is transmitted. A lot of the national surveys show that somewhere around 65, 67% of the adult population is ready to get vaccinated, which means that final 10% is going to take work. It's going to take education. It's going to take trusted information. And it's going to take a kind of a frame shift, a mental frame shift of why do we even get vaccinated in the first place? Part of the core public health message every year around flu and really around vaccination writ large is that, yes, it is about protecting yourself, but just as importantly, it is about protecting your neighbor, your friend, your grandparent, the infant next door. And so I hope that people, as we've lived through COVID and we've seen the transmission of disease affect communities, that we start to not just think about how do we protect ourselves, but how do we protect our entire community. And that has to happen through us getting to a certain target in herd immunity. So I'll talk a little bit about the safety profile right now. And I think particularly with the Johnson & Johnson vaccine, because we have seen some social media messaging, some national media headlines around the concerns with J&J perhaps being a lesser vaccine. Absolutely not the case. And so a couple of quick things for everybody to understand. These vaccines have all gone through extensive clinical trials, multiple months, tens of thousands of people. Moderna was 36,000 people participated in that trial. Pfizer, 44,000. Johnson & Johnson, above 40,000. So really significant trials and across all types of demographics. And so with that, what we've seen with all three of these vaccines is that they are virtually 100% effective in preventing hospitalization and death. And from the public health perspective, that's the thing that we all care about the most, is how do we keep people from getting severely ill, getting hospitalized, and prevent them from dying. Because, the vast majority of people who get COVID are just really mild illness, and many who are asymptomatic. And so I very much foresee a place where when we get to herd immunity, when we really stop this mass transmission, we will still see COVID circulate. We will still see mutations and variants circulate. But if we can protect people against those really severe outcomes, this will be kind of similar to the flu in that most of the illness will be mild and will be protected through vaccination against that severe disease. Maybe a little bit more on the Johnson & Johnson vaccine. The thing that people have raised concerns about is that the initial data that the FDA presented, or that the company presented to the FDA, was that the vaccine was 66% effective, and in America, 72% effective against mild to moderate disease. And people hear that number, 72%, and they compare it to the 95% efficacy rates that Moderna and Pfizer reported when they were originally authorized back in December. And so, I think it's pretty natural that people immediately come to the conclusion, 72 is not as good as 95. I'm not going to get the J&J vaccine. But it is more complicated than that, because Johnson & Johnson has been trialed at a time where we have a really different context in terms of circulating variants. Johnson & Johnson trials happened in 8 different countries across 3 different continents, many more circulating variants than were the case during the Pfizer and Moderna trials. And so we haven't been able to do a head-to-head study yet against J&J versus Moderna versus Pfizer. And it would be really interesting to do that. And I think that kind of work will get started moving forward. But even despite that different context, still 100% preventive against hospitalization and death. And so I think maybe to boil it down, the 2 basic talking points that as you talk to friends, colleagues, family members, incredibly effective against the outcomes that matter most, and that we can't really do a head-to-head comparison because they were trialed at such different times in such different contexts.
Thank you so
Great,
much,
thank
Dr.
you.
Avula.
Okay, on to our next caller. That's Terry from Spotsylvania. Terry, you're live. Go ahead and ask your question, please.
Thank you. I really appreciate this. In baseball terms, we're like halfway between first and second, and I'm concerned about the variants, the ones that we know and the ones that might mutate and come up again, and how we're going to check the the existing vaccines against those variants. I realize the doctor's already got into that, but how we're also going to identify new variants, because there's still a huge number of cases, and the more cases you have, the more likely you're going to have mutations, as we already know from the flu every year. And that's what I'm concerned about. I'm getting my second Moderna right in the next week, and it would be nice to know that the Moderna would also be effective against the South African, the New York, the California variants. They might be the same. I just don't know the knowledge. Thank you.
Thank you so much, Terry. Dr. Avula, I think this one's all yours.
Well, it's a great question, an important question, because we are seeing variants emerge throughout the world and here in the United States. Right now, the UK variant, the B117 variant, accounts for about 20% of the cases that we're seeing in the United States. The CDC estimates that by the end of the month, it will be the predominant strain. We've seen it really quickly overtake the milieu of viruses in other countries. I was on the phone with my colleagues in Israel about 3 weeks ago, and from the time they saw their first case of B117, the UK variant, 2 months later, it had become 70 to 80% of the cases in their country. And so definitely a concern. What we know right now is that all 3 of the vaccines are incredibly effective against the B117 variant. So in many ways, the speed and efficiency by which we get our vaccine out, and the faster we get our community vaccinated, the more protected we will be from this emerging threat. There are ongoing studies in other parts of the world against some of the other variants you mentioned, certainly the B1351, which is the South African variant. The initial data has not looked as reassuring in terms of the effectiveness of the vaccine. In fact, Moderna has started to test a booster that includes the South African variant in case we might need to introduce that a few months down the road. There is also an emerging P2 variant out of Argentina. And so we're waiting for more data, but there's definitely ongoing studies happening with all of not just the 3 here in the United States, but there are many other vaccines across the world that are being used. AstraZeneca as one of those leading ones that's being used in many other countries. But more and more data is being gathered around their efficacy against variants. And what that might mean is that we get, like we do with the flu vaccine every year, where it's reformulated because of new strains of flu that circulate. I think the odds are pretty good that we will likely do a yearly booster around COVID, at least for the next few years, as these variants emerge and become a part of the mix.
And when Dr. Avula is talking about, all of the surveillance that's occurring, part of the American Rescue Plan, so the bill that we just passed in the House and that the president just signed into law, does include $49 billion in total for testing. And of that, it also includes money that is specific for the purpose of that surveillance of potential variants that as they come to the United States. So that's an important component aiding in the process that Dr. Avula was just outlining.
And maybe let me respond specifically to the genomic surveillance to help people understand how we are tracking and monitoring for this. So right now, the state lab, DCLS, where much of the testing in Virginia runs through, is doing genomic surveillance on about 15% of the cases that come through. Now, they ramp that up if there is a known travel history or if there is a cluster or an outbreak, then they genetically sequence those strains. But otherwise, they do a random algorithm to just look for the emerging presence of variants. And then we do a press release periodically when we find, like I think there was one today of the South African variant in the Northern Virginia region. In addition to what the state lab is doing, the CDC has also contracted with a number of other labs like LabCorp and Quest, some of the commercial labs, to also do random genetic sequencing. And so with all of those different pieces in place, we are catching and able to monitor when certain strains are emerging, like the B117.
Thank you, Dr. Avula.
Thank you. Our next question comes from Kirkland from Midlothian. Kirkland, you're live. Go ahead and ask your question, please.
Hello. Thank you for taking my call, Congresswoman Spanberger and Dr. Avula. My father is a two-time cancer survivor, and as such is at a greater risk for COVID complications and severity. My mother suffers from severe asthma, and so my siblings and I, who are college students, all three of us, have been unable to interact with them beyond socially distant outdoor meetings and stuff like that. So I haven't been able to hug my parents in a year. How soon can college students, because I know that they're getting vaccinated quicker than we are, but how soon can college students expect to be vaccinated, and what can we do in the meantime to help in just the general effort of keeping cases down and vaccination rates up?
So Kirkland, I want to say as a parent, your attention to your parents' health is extraordinary, and I look forward to you being able to hug them very, very soon. In terms of the time frame, I believe that I'm going to again turn this one over to Dr. Avula because I know he has the very, very specific promises of when you might be able to give your parents a wonderful hug.
Yeah, well, the good news based on CDC guidance, Kirkland, is that it's probably right around the corner for your parents to be able to interact with you without concern. So the CDC just released new guidance earlier this week that when individuals are fully vaccinated, which we consider 2 full weeks after the second dose of a 2-dose vaccine or 2 full weeks after your Johnson & Johnson single-dose vaccine, you're considered immunized. And so what the guidance says is that you are now allowed to interact with other people who are fully immunized in a household without masks, interacting normally, or to interact with some more caution with one other singular household. So in this case, it might be you and your siblings interacting with your parents. Without masks in a household. Now, what gets tricky is when there are multiple household gatherings or people who are having different levels of exposure, and then you want to be really careful in those scenarios. But I think all that to say, a hug does seem around the corner, and then to give you a little bit more of a timeline, I'm glad to hear that your parents are getting vaccinated now. That sounds right on track in terms of our 16 to 64 population with underlying conditions that is being vaccinated right now across most of the state. For healthy young adults who would fall into, if they don't qualify through employment, then they would be in phase 2 with the general population. I really think end of April and through the month of May, we'll be vaccinating that general population as well.
Great, thank you. Our next question actually comes online. It is John from Chesterfield. He says, I live in Chesterfield County. I am over 65. What are the major obstacles still keeping us from getting vaccinated?
Well, John, I think we're at a point where it really is expanding for anyone who's 65 or over. So if you are pre-registered on the state website, vaccinate.virginia.gov, or you can call the 1-877-VAX-IN-VA number to make sure you're pre-registered. We are actively pulling lists of people who are 65 and over for ongoing events. And so a couple weeks ago, we were doing that for Walmart in Chesterfield. I know they are holding multiple events every week and really prioritizing the 65 and up population. So there really should be an opportunity, this week or next week, as Chesterfield continues to work through work through those lists. There are a couple of other pathways outside of the state pre-registration system. CVS, for example, is, and many of the pharmacies are all focused on the 65 and up population, but CVS has a registration platform that runs parallel to the state pre-registration system. And so if you go to cvs.com, you'll be able to see appointments that are available, in the Central Virginia area and beyond. But really, in the next week or so, so I would encourage you to call 1-877-VAX-IN-VA and just make sure that you are pre-registered and that you are in line, because it surprises me that you haven't gotten that call yet.
And Dr. Avula, one of the things that I've heard from my conversations with some of your counterparts as well is that those calls are going out from volunteers, from county employees, from Medical Reserve Corps volunteers to get people scheduled. So not to state the obvious, but it's very important that people answer their phones when they get unknown numbers. When I've done tours of some of the places where those outbound calls are getting, some of the volunteers are saying that they are getting quite a few voicemails and answering machines. So please know that someone's calling you with the helpful information in an effort to ensure that you can get your appointment.
Great, thank you. We're going back to the phones with Michael from Midlothian. Michael, you're live. Go ahead and ask your question, please. Michael, are you with us?
Yes, ma'am.
Okay.
Is Ms. Spanberger?
Yes, Michael, how are you?
Good. How you doing, ma'am? I met you at work. But
Nice to talk to you.
But I was wondering, how do we plan on paying all this debt off? You guys got to look into the future, because we don't want our kids, to be burdened with all this stimulus stuff.
Yeah. Well, Michael, you raise a question that is an important one, and it's one that I've been focused on. And, this is a place where I've been looking to economists and to economic experts, including the chairman of the Federal Reserve, who's continued to press on the fact that we need to continue the momentum of our recovery. And we need to ensure that we are getting people across our country vaccinated so that we can fully open up our economy, that we can have consumer confidence, that people can walk into restaurants and know that they will, without a shadow of a doubt, be safe, that small business owners can ensure that they're building back up the number of consumers who are walking through their doors each day. And that comes with an investment in our ability to defeat this virus and to do it quick. That was one of the reasons why last year multiple bills went through Congress, the House, and were signed by the previous president, focused on making those significant investments, focused on Operation Warp Speed to try and get the vaccines ready, and focused on stabilizing our small businesses, avoiding a housing crisis through housing and rental assistance, and supporting those who are experiencing not just the pandemic, but also the economic crisis that it's associated with it. So this becomes a question of the investment that we're making in our community, the investment that we're making in our ability to get kids back to school. And across the 10 counties that I represent, each county has taken a different path, but looking towards the fall, ensuring that we can be back in a place where parents know that their kids will be safe in school, where parents who rely on child care providers are not worried about that child care provider going under, and that we can ensure that we get the economy going. And so I know, I will say, I can't overstate it enough, and I know I've just stated it a couple times. This is an issue of investing in continuing this momentum. And it's a challenge. I am a person who is focused a lot on how we're going to pay for things, how we're going to pay for these big ideas. But here, the reality is that we have to invest in our own recovery. And according to economic researchers across the board, doing so is what is necessary to start stabilizing, strengthening the economy, getting our unemployment numbers back up, unemployment numbers back down, employment numbers back up, and by virtue of that, ensuring that all those unemployed people are bringing back in the revenue that we've invested in this recovery.
Great. Thank you. Sticking with the phones, we have Anne from North Chesterfield. Anne, you are live. Go ahead and ask your question.
Hi. My difficulty is that I'm in a gray area for my work. I'm a librarian that is not actually part of any government organization. We are a regional system in Hopewell, and thus not associated with, like, for instance, Chesterfield County is associated with Chesterfield County. And so I'm not really able to put on my vaccine information, that I'm not a government essential employee, and I'm not a teacher, but I've been working with the public closely since July, helping them with the computers and applying for jobs and that sort of stuff. I'm just trying to make sure that I've accurately filled out my VDH information, because I'm in such a gray area that there really isn't my profession on there.
Yeah, and as you can imagine, there have been a lot of sort of considerations of different classes of employees and requests to move an employee group into 1B or 1C. And I actually just spoke with somebody at the Richmond Public Library Board about this today. So librarians you're right, they're not included into one of those essential worker personnel. And so unless you qualify through either age or your underlying condition into 1B, then you would be considered in that phase 2. But as I said, things are moving very quickly here in the next few weeks. And so I really expect by, the end of April or the beginning of May, we will be opening up into phase 2. So really, we're just a few weeks away at this point. So in the meantime, I think doing all of the things that we know will protect you, wearing a mask and maintaining your distance, washing your hands frequently, and then certainly if you develop symptoms of any kind, staying home from work and getting tested. And I think as if people are adhering to those practices, we'll be able to continue to keep each other safe until everybody can get vaccinated.
Great, thank you. Our next online question comes from Monica. Can you comment on the crisis at the border?
That one's not vaccine related, Danny, so I'll take this one. Monica, thank you very much for this question. So, the United States continues to be a beacon of hope in the world, even during a global pandemic. And so we continue to see that there are individuals who want to come here for work or to seek refuge. I have been a strong and consistent supporter of our requirements as a nation to ensure that we are protecting our borders, that we are able to understand who is arriving at our borders, that we are the ones in control of the decision of who is able to come and into our country. It's for that reason that I have worked on border security related issues during my time in Congress since first arriving in 2019. When we're looking at what drives people to come to our southern border, we have to look at the root causes of immigration. And doing so enables us as a nation to address the issue, to have conversations about how we get at the challenge. And then for people like me who are tasked with legislating, we can actually make informed policy. So last Congress, I led an effort with a Republican colleague from Texas, a fellow former CIA officer, to work on legislation, which was ultimately signed into law by President Trump, focused on utilizing our intelligence capabilities to understand and to track the entities that do cause so many people to flee their countries of origin, oftentimes making their way north to the United States and to our southern border. So this piece of legislation was important because so much of the reason why we have seen in the past and continue to see people who are trying to seek refuge in our country, it's because of narco trafficking and human trafficking rings. And the piece of legislation that I worked on with, again, my Republican colleague from Texas was to ensure that we can understand those root causes, get at them through real policy to ensure that we can deal with the issues that exist in another country that drive people from their country, and ultimately in mitigating that issue, individuals are no longer in such a desperate place working to move upwards, northwards towards our country. Another challenge and another reason that people continue to enter our country is to work, and particularly in the agricultural sector. And so this has been an issue and an area where I have focused immensely. And notably, across Central Virginia, we have a significant agricultural workforce. And the farmers and producers across our district and across Virginia often depend on laborers who come to our country to assist in their farms and in their fields and in their greenhouses and their dairies. And so I worked heavily last Congress on a bill that ultimately passed with significant bipartisan support, and that bill is called the Agricultural Workforce Modernization Act. And what that bill does is it ensures that the employers, the farmers and producers here who want to be able to employ a workforce from outside the country can have access to the visas necessary to do so, so that they can hire people through a legal process, that those individuals would go through an E-Verify program so that we as the United States know who's coming into our country to work in the agricultural sector. And that notably we would ensure that there are enough visas and flexibility with the program to ensure that the farmers and producers who choose to participate can hire enough of the talented, skilled laborers on which they depend. And so this is an important legislation. It passed with substantial bipartisan support last year in the House of Representatives. We'll be bringing it back up in the House of Representatives next week. Should be the anticipated time. And my hope is that the Senate will move forward. Again, it has, and I don't have the number offhand, but substantial bipartisan support, because it is a common sense. And I've only been in Congress a short period of time, but I can say that not everything is common sense legislation. This indeed is. And it addresses one of the real needs and one of the real motivators why people would want to come to our country, and that's to work. And people want to come to our country and work because we have work for them, and we have employers who want to hire them, and ensuring that people can come here legally and work. Employers can hire them legally is an important part of that equation. So I'll be highlighting that piece of legislation next week. And I do hope, Monica, that you'll take a look at that as well.
Great, thank you. Back to the phone, we have Cecil from Henrico. Cecil, you're live. Go ahead and ask your question, please.
Thank you, Honorable Congresswoman Abigail Spanberger. I am a disabled Commonwealth employee and a disabled veteran, and I have the diagnosis that I have. The number one death is suicide, but I've beat it for 40 years. and so I think I can run the board on it. Thanks to the Department of Veteran Affairs. But I have had issues with them because all they wanted to talk about was my disability, but I got outside private practitioner who is very proud to treat a veteran, and all he wants to talk about is my intelligence and my abilities. He says that disabled doesn't mean unable. And I had today, 1 week ago, I had my first COVID vaccination, and in 13 days, I'll have my other one. So I really don't have a problem with vaccination. I got it at McGuire, and all my shots that I've ever gotten from McGuire worked out good. My tetanus, my pneumonia, my flu. I've never had a bad shot from the Department of Veteran Affairs. But my issue is that it took 6 months for me to get my stimulus package. And I was wondering, am I going to have to wait another 6 months or even longer to get the new stimulus package?
Let me ask you a quick question. Did you receive that via direct deposit or through a check in?
I am considered to be financially incompetent, and I have a government handler, and my government handler sent me my check. I'm on Social Security disability, and for some reason I was put in the back of the line.
Okay. Well, so I'm not 100% sure about your particular experience, but I'll highlight a couple things. One, I want to say thank you so much for your service to our country. Thank you so much for your service to our Commonwealth. And thank you for this question, because I will want to follow up with you after this call to speak to your specific circumstance, sir. But you've presented me with the opportunity of being able to explain just a bit more about what our office do. Now, you've said that you've had good experiences with the VA. We want to let other veterans out there know that if you ever have a question about your VA status of a claim, if you ever have a question, you're welcome to call our office and we can follow along with your case. We can make inquiries on your behalf if things seem like they're proceeding a bit slow. We can't walk on water. We can't make everything happen, but we certainly can be a partner for our veterans in the community as they work to get the benefits that they earned through their service or answer questions related to their benefits. So I would mention that to any out there. And then for people who are expecting or who have received prior stimulus checks, if you have received a prior stimulus check, in this next round, there have been some changes. If you received the full amount of the stimulus check, you should receive the full amount of the stimulus check this next time. In the prior stimulus checks, there was it tapered off very slowly once you at the $75,000, those who make $75,000 or more, it tapered off slowly. These checks are more targeted, and so it will taper off faster. But if you did receive a full amount, you will receive that. Generally speaking, you should be, if it's measured on the, generally speaking, you will be receiving that same full amount. But sir, for your circumstance, I would love to make sure that we have your phone number and we can follow up with you afterwards. For those who receive their stimulus support via direct deposit into their bank, according to the White House, those deposits are potentially going to start as early as this weekend. And for those who received it last time via check, those checks are going to be going out as soon as possible. So people should start receiving them. Certainly with the first rounds, we saw a lot of delays, and some of that was just the actual processing. The second round of checks went faster. But sir, if you would make sure that my team has your phone number, I'd love to be able to make sure that we can answer your specific case. But I hope that those general answers do help others on the line who have a similar circumstance.
Great, thank you. Next up on the phone is Rick from Henrico. Rick, you're live. Go ahead and ask your question, please.
Yes. First, I want to say thank you very much. I think you're doing a wonderful job in reaching out and helping all Virginians. Can you hear me okay?
I can hear you, Rick. Thank you.
Okay, thank you. Yes, I have a similar situation a little bit. I am 100% totally and permanently disabled United States Army veteran. But my question is a little bit different because I'm asking about the new PPP, the loans that they have. I'm sorry, trying to catch my breath here. At any rate, the loans were cut off before for February 15th, and I incorporated February 22nd. And I've been working since December of 2019, and have been paying the staff since then. But I guess I missed the cutoff date, so I wasn't qualified. So I was wondering, under the new PPP loans, will I qualify?
So the new the funding that exists for PPP in the American Rescue Plan is a follow-up for what has already been in place. So there shouldn't be any additional or expanded qualifications. So without knowing all of the specifics of your circumstance, I do not believe that you would qualify for additional support or for support for a business that incorporated after the cutoff date. But again, with you, sir, I'd love to make sure that my team can get your contact information, and then we'll make sure that if it's not PPP, if there's any other support that you might be eligible for, we'll want to make sure that you're aware of that. So I'm sorry, but I think I'm quite sure the answer is no to the first part, but I'd love to be able to make sure we can follow up and see if there's anything else that we can make you aware of that could be helpful in your circumstance.
Great, thank you. And for our last caller this evening, it's Patty from Hayes. Patty, you're live. Go ahead and ask your question, please.
Yes, I'd like to direct my question to Dr. Avula directly. I've heard some anecdotal reports from friends and family members that they've been told by some of their healthcare providers that people are signing up for vaccine appointments and then not showing up, which is resulting in multiple vaccines being wasted. I just wanted to ask Dr. Avula if this is correct. I know you can't believe everything you hear, and I know that this is exactly in Dr. Avula's wheelhouse. This is what he deals with every day. So I just wanted to hear a good, transparent answer from him if this is happening. And unfortunately, if it is happening, what are you doing to deal with it? If it isn't happening, I'd love to hear that.
Sorry, I muted myself. Thanks, Patty. Let me give you a couple of the things that maybe that will clarify what happens when appointments aren't kept. Because although I will say for most of the vaccination effort, the appointments have been near 100%. There are situations where people have extenuating circumstances, they miss an appointment, or there are no-shows. So each vial of vaccine, if it's a Pfizer vial, it's 6 doses. If it's a Moderna vial, it's 10 doses. Once the vial is open, has to be used within a certain number of hours. So every clinic now has a protocol and a wastage policy where when a clinic is monitoring its no-shows over the course of the day, they are actively calling people off of a wait list to fill in those gaps at the end of the day. And if they do get to the end of the day and it happens to be an odd number of people, right? So you open a vial of 10 doses, but you've got about 4 or 5 doses left in there. You can't just put that in the refrigerator. You actually have to use it. And so every provider now has a a waitlist protocol where they will, if it's a large event, they'll either vaccinate some of the volunteers who are there or some of the staff who are working that event. If it's a smaller clinic, then they will call down the wait list as to not waste those doses. Obviously, that doesn't happen 100% every time, but those policies and protocols are in place, and we have very few instances of wastage. Now, there are some situations where because the Moderna and Pfizer in particular are very fragile vaccines, if you accidentally drop a vial, the manufacturer then says you can't use that vial anymore, and so that has to go to waste. Or if a provider is just because, again, the Moderna and Pfizer are a different platform of vaccine, a lot of vaccines, you're actually instructed to shake the vial as you prep it to draw out of it. Moderna and Pfizer, you cannot do that because shaking the vial will actually deconstitute the vaccine itself. And so if you inadvertently shake the vaccine or drop the vial, it has to go to waste. But really, we've put protocols in place to work through wait lists so that we waste as few doses as possible.
Great. Thank you, Dr. Avula. As we come to the end of our live event, I'd like to turn it back to Congresswoman Spanberger for closing remarks.
Thank you very much to everyone who joined us today, and I want to especially thank Dr. Avula for providing so much great information. Dr. Avula, again, for everyone on the line, is Virginia's Vaccine Distribution Coordinator. I'm so grateful that he was able to join us today and answer so many questions. I was about to make a joke that it was Danny Avula's town hall, but I am so grateful that you've been able to answer the questions for the people of the 7th District, because frankly, this is what we're hearing about. People are calling our office. People are writing us emails, sending letters. This is the concern that people have. It's understanding the truth about vaccines. It's understanding what the, all of the numbers that get reported in the press mean. If there's differences between the vaccines, if there's concern about vaccine wastage, and we're hearing these questions every single day. So I'm really grateful that Dr. Avula gave us such clear, concise answers about why we should all trust the vaccines that are out there, why we should encourage our friends and family to ensure that they are getting vaccinated, while we should be, feeling confident about the efforts that our public health officials are undertaking and the ways they're getting creative with rolling wait lists to ensure that every single vaccine that is eligible to go into someone's arm is making it there. And I have visited some of the mass vaccination sites that we have in our district, and they are extraordinary undertaking with volunteers who are focused on ensuring that our community members are safe, that the vaccine is able to get to as many people as we possibly can. And so I'm really proud of Dr. Avula joining us this evening. To constituents on the line, thank you for being here. Thank you for listening. Thank you for your questions. I know we didn't get to all of them tonight, but I hope that this has given you a glimpse of what the priorities and what the things are that we're working on. And right now, this week has been so focused on COVID-19 response with the American Rescue Plan. My expectation and what we've been working on is to ensure that it's delivering the much needed support to our ongoing vaccination efforts, to our ongoing testing and surveillance efforts to ensure we can get ahead of any potential variants, and that we are ensuring that our economy can continue to stabilize and ultimately rebuild. There are many other issues that are of great importance to people across this district. So I am just grateful to everyone who sent in letters, who's made calls, who's inquired about the issues that matter. Our country is stronger when we are focused on our engagement. I represent you all. I know we will not always agree, but I'm grateful for the honor to serve you all, to listen to you all, and I certainly look forward to the opportunity when I can stand in front of you all and see face-to-face the questions that you all have to ask into the future. So I look forward to that day. In the interim, we're going to continue doing these telephone town halls, and I am so appreciative that you chose to join us. We'll be posting this online, so if you want to go back and listen to any of the answers to the questions that we had, particularly the stellar answers that Dr. Avula gave us, It'll be posted on our Facebook page and on our website, spanberger.house.gov. We have a weekly newsletter and occasionally add in an extra one when we have information, particularly during the COVID pandemic. We've provided much needed resources related to everything from unemployment programs to vaccine signups to how people can volunteer with the Medical Reserve Corps, in addition to legislative updates on all the work that I'm focused on here on Capitol Hill on your behalf. So again, you can sign up there at spanberger.house.gov. And thank you again for joining. I hope you all are staying safe, and I hope you get to enjoy a bit of the warm weather this weekend. Thank you, everyone, and I look forward to you joining us next time.
Thank you, Congresswoman Spanberger. We are coming to the end of our live event this evening. Thank you for taking the time to join us for this important telephone town hall with Congresswoman Abigail Spanberger and Dr. Danny Avula. We appreciate the opportunity to answer your questions. But if we were not able to get to your question this evening, you can call our district office at 804-401-4110 during normal business hours or go to spanberger.house.gov. Thank you again. Stay healthy and safe, and have a good evening.